Gentlemen, welcome to what might be one of the most exciting episodes for guys that we have done yet. Because today we're going to talk about a topic that is near and dear to every man I know, and that is their sexual health and sexual function. Today, we're going to talk about one of the new therapies that we have here at Sage that is absolutely incredible. Of course, it's Barry Napier. I'm here with my co-host, Dr. Angela Yeagley.
Hello, everyone.
Welcome. So today we're going to talk about vascular regeneration therapy.
For ED.
For ED,
Yeah.
Exactly. So erectile dysfunction is, it's kind of like the boogeyman, and it's something that a lot of men are afraid of. And when the boogeyman comes or there's that monster under your bed and you're afraid to get out of bed, you're also afraid to talk to people about it. And ED is a scary topic for a lot of guys who have it, guys who have gone through it, and guys who are afraid that it might be coming on, right? That they might be experiencing more symptoms. And in my experience, it's very normal for guys, especially as they age, as they get into their 30s, 40s, 50s, 60s, to start dealing with some level of ED in their life.
Mm-hmm.
And
difference than from when they were in their 20s.
Yeah, a difference. And so whether they would classify it as I have ED, or just like, things can be a little hit and miss in the bedroom, or like sometimes I don't respond with the quality and the strength or the consistency or frequency of erections that I used to when I was younger. And I get it. It's not like you're sitting around with your buddies or your spouse even, at dinner, and you're like, hey, let me tell you about my penis problems or my big worries and concerns with my junk, It's like, and so a lot of guys carry this. It's something that, sometimes they're even afraid to bring up to their doctor or talk with because they just are a little bit maybe embarrassed, or there's a feeling of I'm a less than, or like, what's wrong with me? Or like, it must be, maybe this is just normal and natural part of aging. A lot of stuff like that goes into ED for guys.
I love that. Thank you so much for sharing all of that. And I love that intro because I think you're absolutely right that I think it's becoming more open now. There's a lot more treatments that you see advertised that are like, hey, ED can be a normal part of aging. Like if it bothers you, we can address it.
Totally. And I think, when some of the ways that we treat ED are we look at, Viagra and its generics and some of these other various pill forms right now. With the generics, you have seen an explosion in third-party advertisers. There's a company like Roman and a whole bunch of others that do advertise very aggressively and openly about ED and about solutions for ED, in the pill form. So I do think you're right. I do think it's, they're tapping into a large market of guys there who definitely want more consistency or want to feel that confidence in the bedroom or wherever when it comes to their sexual performance.
Yeah, which I think is fantastic. Again, more education and awareness is always good, right? So today, absolutely, there are a lot of other options for ED, definitely oral. If you're talking to a urologist, many times they will have injectables that can be done, as well as like pumps, things like that. So today, though, is a little bit of a different approach.
Yep.
More of a regenerative therapy of the tissue.
Yeah. So obviously here at Sage, we are all about tapping into the body's natural healing power. And there's a lot of different therapies we look at that do that in different capacities. And this is a way that we can tap into the body's regenerative abilities when it comes to the strength, frequency, consistency, et cetera, of erections, and helping to restore a healthier, stronger function when it comes to the quality of your erections.
Right. So today we're going to dive into a therapy called Shockwave Therapy. However, really, I think a better way to think of it is vascular regeneration therapy.
Yeah, and we've talked about this therapy in the past. Uses a type of energy modality based around sound wave that can penetrate deep into tissue to stimulate repair, blood flow, stem cell growth, et cetera. We'll get into all of the ways that it works when it comes to helping with ED. But yeah, shockwave, that sometimes can be a scary word. Sometimes people hear that word and they're like, shockwave, like, and they're imagining, where, we have a car battery and like a couple jump starters, and we're like just putting one on your penis and one on your ball sack, and we're like, yeah, get ready for shockwave, we're going to get things going down here. Mm-hmm. But like completely not like that at all. So that's why we prefer, when we're talking about ED, we talk about vascular regeneration, because that's really what's going on.
Absolutely. So like if we're talking about the benefits of doing sound wave therapy, what's really amazing about this therapy, sound waves are penetrating the tissue. They actually they stimulate certain growth factors that work on repair of the tissue, that also call basically the localized stem cells to the area. So again, regeneration. Also work on stimulating angiogenesis, which is the formulation of new blood vessels in the area, which is incredible that we can do that, right? That you can take a therapy and apply it to a tissue. And, as we know, shockwave can be used in other areas of the body, but say with the penis, right, we can apply it and you will start regenerating more actual blood vessels in the area. And so increase blood flow in that way, as well as increasing the amount of smooth muscle in the area too, which I think is it's amazing, right? So you literally are increasing the tissue and growing vessels, making more, you're making more flow versus compared to if you're doing Viagra or Cialis or the generics, they are helping you to increase your nitrous oxide to nitric oxide to improve the amount of flow that can come in, but they are not increasing the amount of vessels that are there. Right?
They're not fundamentally changing your capacity or your function at that kind of cellular level, at the vascular level, at the tissue muscular level, as well as it also can clean out plaque deposits and some of those other blockages that can occur that can actually restrict some of that blood flow and make stuff like Viagra and some of those nitric oxides less effective.
Yeah, absolutely. So break up adhesions and different types of calcifications, right? Yeah. So that's where, this is not our topic today, but say something like Peyronie's disease can be a really good, this could also apply to that as well.
You can think of it almost as strength training for your Johnson. It's increasing its pump factor, it's increasing its vascularization, it's increasing the muscle tissue. So do you want a stronger, do you want a stronger unit? And this is a way to get there, because there's basically not a lot of strength training you can do for your man part. Except this.
Say, probably now that it's becoming one of my favorite parts of this episode is all your different names for the
male sexual. I just hate the word penis so much. It's so clinical and dumb. I just can't even.
I love it. No,
I'm using
going with it.
Every possible other word I can think of that's not profane.
Yeah.
Although I do love a lot of profanity personally. I'm trying to keep this PG for our listeners. I don't want anyone to be offended. But yeah, so let's so I think everybody knows kind of what the deal is with ED. I mean, if we were to explain what is it, basically, it's just, it's when things are not working down in, pleasure land like you want them to, and you're frustrated, and you start to get worried that, either you can't get hard in the beginning, or you don't last as long as you want to completion. And that is really frustrating, right? So we all know what ED is. And, we talked a little bit about how vascular regeneration therapy helps in terms of, fixing some of these problems with blood flow and tissue and all this, a lot of which is just natural part of aging. Of course, you throw in lifestyle factors and other medications that people can be on. Those things can all also have negative effects on our sexual performance as men as well.
Absolutely. And I love that also that you have mentioned that of course, say, we're talking about this very specific therapy, but we always want to work on everything else. If you're coming to see us, if there is a little bit of a weight problem, and that's contributing to cardiovascular disease and risk, which is tied into ED, or you have prediabetes, or diabetes, we need to address those things as well. So the process of damage does not keep occurring extensively over time, right? And those things we know, sometimes people think oh no, now I have cardiovascular disease, or I have diabetes or prediabetes. That's it, right? Now I have this, right? Yeah, I'm not turning around. That is absolutely not true. There are so many things that we can do to really help to change the cells and the lining of your arteries, things like that, improve the healing of your tissues. So many things, right? You just have to go back and look at all of our podcasts and see all the things that we do. So really, a comprehensive approach is going to be fantastic, and mental, right? Of course, there's a mental component
There's
as far as like
absolutely.
connection, or if there's low mood, right?
We might look at other things like testosterone therapy, right? We might look at see like where we know that low T levels might be associated with low libido, low desire, or low drive. There's a lot of factors that could go into it, but when we're just talking about improving kind of the mechanical function of your Wang, this is what we're looking at. Okay, we're looking at VR therapy. So let's talk a little bit about how it works.
Okay. Yes.
So the process, like
The
if you were to
process,
come in, if you were like, okay, cool, well, what's it?
yeah.
I got it,
What
I
should
get
you
it. This
expect?
is it's like strength training for my Johnson. I want him to be big and beefy and strong and just powerful, ready to go. This is cool. That sounds interesting to me. How it happens? What's the therapy like? What do we do?
So typically, the standard treatment protocol is going to be 6 treatments. Sometimes we'll need to do more, but that's the standard. Ideally, it's 1 a week for 6 weeks. You're going to come in. You're going to do numbing.
Yeah, we put a very just a local, like a topical type cream. So you just apply a little cream to the shaft and sit for in a little bit of your pubic area, right? So just kind of numbs the general area, and you hang out for 23 minutes, let that sit in, and then we take it to the next step, which is the therapy.
So the therapy itself is going to be, between 20, probably around 20 minutes.
Yeah, it's pretty quick.
Yeah, it's pretty quick. And then the numbing is going to last for a while. So if there's a little bit of like discomfort that maybe was experienced, because, again, you are stimulating those tissues, right? So that numbing agent is going to be lasting for several hours. So
don't plan your sexy time.
Yeah, don't
right
plan
after
date night.
Yeah, that's not date night, But the next day, you probably be good to go. But definitely that day that numbing cream is gonna interfere with things.
It's going to interfere with
things. It's like a therapy. It's like kind of it's like getting a massage, a Johnson massage, in that way that it is a manual type therapy.
Yeah.
So the Shockwave device is, if you can picture this, kind of like a wand. It has a specialized tip, and what we do is we lubricate the shaft with a little bit of a gel, kind of like an ultrasound type gel, and then we apply the Shockwave device to the shaft in a number of different locations on kind of each side in the middle. So we kind of treat the whole shaft, and that allows that energy wave to really get in to these different sections of the shaft, the Johnson shaft, to then create all of that benefit that we talked about earlier in terms of this muscle tissue and improving, getting rid of plaque or deposits, adhesions, improving, stem cell stuff, blah, blah, blah. So that process, it takes about 15-20 minutes.
Yeah. I mean, the numbing will be the 20-30 minutes. 30 minutes, it's really kicking in. So you'll come in and do that yourself. We'll show you how to do it. And then the therapy happens after that. And there's a couple of extra points on like the pubic bone. And we can include the perineum, which is going to be, if there's also, maybe we're suspicious that there's some prostate, issue going on there, which most men will know because maybe they have like a weaker flow, or they've been told by their urologist or their doctor, or there's, leakage sometimes, or incompletion.
Yeah, we'll treat the whole area. So we kind of do, kind of above and around, down the shaft, and then kind of underneath the testicle area and that perineal area. We'll do a little treatment there. So it's really, really not, it's not invasive. It's not painful. With the numbing cream, you're really not going to feel that much. And then will you be sore or tender later in the day when the numbing cream wears off? Very, very mild to none. So for most people, you might notice it like if you would have a massage before where you're like, oh yeah, I had a massage, and there might be a little bit of tenderness,
like
but it's
sore spots.
Yeah, but it's usually pretty mild.
Yeah. So, I mean, what I think is really exciting are the studies around this. There are many, many, many clinical trials on this type of therapy for ED. And I would say, so it's most appropriate in the studies for mild to moderate, right? And that's all based on scoring. It's called a sham scoring. And which is like, how many nighttime erections do you get? How long does it last? Can you maintain an erection? Just things like that. So it kind of gives you a general sense of where you're beginning. And this is something that we would reevaluate at the end. So works best for mild to moderate. However, there have been studies on severe. And severe would be that maybe even with, things like Cialis and Viagra, it's not always guaranteed to be effective or work, right? Mild to moderate, no, it's going to help you. You're going to get some benefit from that medication. So it's even worthwhile experiencing, if you're on the more severe end, although in that area might not be the only thing that
this might be part of your kind of your solution approach, but it is what's great about it. It is it's non-invasive, it's non-surgical, it's something you come in for and then you leave, and then you start to experience the benefit as over time. I will say it's not like an immediate thing, like the very next day. I mean, you got to remember, this is promoting regeneration. So, and it's not like a one and done. Like we said, it's usually 6 treatments is what
I would say 6.
Yeah.
That's what
kind
you're
of the standard. Yeah. That's what you're going for. And so what you'll notice over time is that as you get treatments, you'll start to accrue more and more improvement in terms of spontaneous erections, like those sleep, nighttime kind of things, as well as starting to see stronger, firmer, more consistent erections when you want those erections to come as well.
Yeah. One of the studies looked at, in just again, a group of men with mild to moderate, 27% of the men who completed the series, and they did, I believe it was depending on the category, 6 to 9 treatments, 27% had complete resolution of the ED. And I thought, oh my, that's incredible, right? Complete resolution. I think that's really significant. The rest of the men, up to 75% of them, had significant improvement, like 70% improvement. And that's all based on that scoring, right? So there were, a handful of men that didn't notice, they felt like they didn't notice, a significant amount. There was some change, but they weren't sure that it was like that significant. So that is a possibility. But
yeah, I think this is, like anything, different people respond differently to different treatments, different therapies. So, is it possible that you could go through this and just see like a slight or moderate improvement? Yes. Could you go through this and have it completely take care of any issue you're having? Yes, you can also. That's also a possibility.
I think it's amazing.
Yeah, it's super amazing. And most likely, you're going to be somewhere in that range, right? Like anything, it just depends on you and how you respond.
Yeah.
But it is another interesting study that I read just recently is where they were measuring tissue flow and activation using ultrasound. And there was a very significant and distinctive improvement with the ultrasound before and after going through this using the vascular regeneration therapy versus the placebo. So I do think this is something that is, what's cool about that is that it's not just changing or improving your confidence and maybe like, hey, I'm getting this treatment and I think it's working. And then that has like that positive feedback loop. But there is also this physiological that is demonstratable and measurable type of change that's happening in terms of your tissue, blood flow, etc. So that's what is really cool about this therapy.
Yeah, being able to see it. Yeah, see the change. And I do want to mention too that there are categories of men as well that they are going to get improvement with that 6. However, there are studies where they then go on and complete another 6, right? And then get continued increased amazing results, right? So that could be a possibility as well. It doesn't mean that if you do 6, like that's it, you can never do any more again. This is the most result you're going to get. It's very possible we'll reach that 6 and go, you know what? You've made such great improvement. We're not maybe quite where you'd like to be. Let's do another 6, right? And there are definitely studies on that. Then you think like, well, then what happens? Like, is that it for my whole entire life? That's all I need to do. Typically, most men will come back in for maintenance each year. Now, that might not be all 6 again, but it could be like 3, right? Just coming in like, hey, just going to keep things opened up, continue to work on the cardiovascular risk, things like that, making sure your testosterone looks good. So there could be some maintenance as you go along. Might not necessarily need it, but it's something just to consider as well.
Absolutely. So if this is something that you're interested in, or something that's kind of want to learn more about, highly encourage you to do a ton of research. There's all kinds of stuff out there. You can certainly do your own research. You can also give us a call and we'd be happy to kind of consult with you on this and look at it as part of a standalone therapy or as part of a more holistic treatment program that we can put together that might address multiple health modalities. But this is absolutely something where you're like, hey, I know I'm dealing with this to some degree. You don't have to, you just know you don't have to deal with this alone. You don't have to bear a burden of shame or fear or uncertainty. Like, this is something that can work and it can really help. And if it's something that you think would be valuable or beneficial for you, then give us a call or book your consult online, come in, and let's explore it to see if it is a good fit for you.
Absolutely. And I do want to mention too that you can be with, female practitioner or a male practitioner. So whatever you are comfortable with, right? We will have that available. So
yep, and there's all kinds of great pricing and packages along with kind of bundling this. So there's ways that we can fit this into your budget and different financing options and various stuff. So this is something where if you're dealing with it, there's a lot of ways to approach it so that cost isn't a prohibitive factor for you on this, and that you can get the benefit now versus waiting for some future date where you think, okay, it's all the right time. It's like,
yes,
just getting older.
Yeah, right.
Why not juice that Johnson up while you can now?
That's right. Yeah, take advantage of the packaging, the packaging and the financing and the discounts and all of that stuff. And yeah, let's get you in, I would say, right away.
Yeah, so thanks for being here. We'll look forward to catch you on the next episode. And remember, guys out there, you are not alone. This can be solved. We can help you. Do not suffer in silence, and don't take a less than position in your life when you can feel your absolute best in the bedroom and beyond.
Yeah, there you go.
All right, guys, talk later.
Okay, bye.